Every year, millions of older adults are told by their doctor to start taking a statin. It's one of the most commonly prescribed medications in the world, and for good reason. Statins have been studied in more clinical trials than almost any other drug class in history, and for many people, especially those who've already had a heart attack or stroke, they meaningfully lower the risk of having another one. But if you search online, you'll also find no shortage of videos claiming statins are secretly destroying your heart, draining your energy, and shortening your life. So what's actually true? As a topic, this deserves a careful, honest look, because the real answer isn't as simple as statins are miracle drugs or statins are poison. It's somewhere in between, and understanding that middle ground is what actually helps you make a good decision with your doctor. Let's start with what statins are actually designed to do. Statins work by blocking an enzyme in the liver called HMG-CoA reductase, which the body uses to produce cholesterol. By partially blocking this enzyme, statins lower LDL cholesterol, the type most strongly linked to plaque buildup in the arteries. Over years, that plaque buildup is what leads to heart attacks and strokes, so the theory behind statins is straightforward. Lower LDL, slow the buildup, reduce the risk of a cardiovascular event down the road. This isn't just theory. Large randomized controlled trials, the gold standard of medical research, have repeatedly shown that in people with existing heart disease or a high calculated risk of developing it, statins reduce the rate of heart attacks, strokes, and cardiovascular death. That's why major medical organizations, including the American Heart Association and the American College of Cardiology, continue to recommend them for specific groups of patients. Now here's where it gets more nuanced, and where a lot of the fear-based content online isn't entirely wrong. It's just exaggerated and stripped of context. Statins do have real documented side effects. The most talked about is muscle pain, medically referred to as myalgia. Clinical studies estimate that somewhere between 5 and 10% of people who take statins report some form of muscle aching or soreness. Though interestingly, when researchers run blinded trials where neither the patient nor the doctor knows who's getting the real drug versus a placebo, the gap between the two groups shrinks considerably. This has led some researchers to believe that expectation and anxiety about statins may actually contribute to how much muscle discomfort people notice, a phenomenon sometimes called the nocebo effect, where anticipating a side effect makes you more likely to perceive it. That doesn't mean the discomfort isn't real for the person experiencing it. It is real. It just means the picture is more complicated than statins definitely cause this in everyone. There's also a much rarer but more serious condition called rhabdomyolysis, which involves the breakdown of muscle tissue severe enough to release harmful proteins into the bloodstream that can damage the kidneys. This is a legitimate risk, but it's also extremely uncommon, generally estimated to occur in a small fraction of a percent of statin users. And it's more likely in people taking higher doses, combining statins with certain other medications, or those with kidney problems already. Doctors are trained to watch for this, which is part of why routine blood tests are sometimes ordered when you start a statin or increase your dose. Another point you'll hear a lot about online is the relationship between statins and coenzyme Q10, often shortened to CoQ10. CoQ10 is a compound your cells use to produce energy, and because it shares part of the same production pathway that statins block, there is scientific literature showing that statins can lower circulating CoQ10 levels in the blood. Where the online claims go too far is asserting that this definitively causes heart failure or is responsible for widespread fatigue across the board. The research on CoQ10 supplementation actually helping with statin-related muscle symptoms is mixed. Some smaller studies suggest a possible benefit, others show no significant difference compared to placebo. It's a genuinely open question that researchers are still studying, not a settled fact in either direction, and it's the kind of thing worth discussing with your doctor rather than assuming based on a video you watched. Statins have also been linked to a modestly increased risk of developing type 2 diabetes, and this one is worth taking seriously and explaining accurately because it is supported by real data. Multiple studies have found that people taking statins have a somewhat higher rate of new diabetes diagnoses compared to those not taking them, particularly in people who already had risk factors for diabetes, like prediabetes or a higher body weight. Researchers believe statins may modestly affect insulin sensitivity and insulin secretion. But here's the context that often gets left out. The increased risk is generally small, and in most major trials, the cardiovascular benefit of taking the statin, meaning fewer heart attacks and strokes, was judged by researchers and regulators to outweigh that increased diabetes risk for people who were already at meaningful cardiovascular risk. This is exactly the kind of trade-off that a doctor is trained to weigh for your individual situation, which is why blanket statements in either direction, statins are totally safe, or statins will give you diabetes, miss the point. The real question is always about your personal risk profile. So why does the fear-based version of this story spread so widely online? Partly because it draws from real published research, then removes the caveats, exaggerates the certainty, and packages it with dramatic language in a story designed to provoke an emotional reaction. It's also worth noting that content which questions medications your doctor prescribed, especially with a compelling personal story attached, tends to perform well on social platforms because it triggers concern and a strong urge to share it with people you care about. That doesn't make every claim inside those videos false. It means the claims are usually cherry-picked and stretched past what the underlying research actually supports. If you're currently taking a statin and some of this is making you anxious, the most important thing to know is that stopping a statin abruptly, on your own, based on something you saw online, is not the safe move. If you've been prescribed a statin because of an elevated cardiovascular risk, quitting suddenly removes a protective effect without addressing whatever risk factors led your doctor to recommend it in the first place. Instead, the constructive path is to bring your questions directly to your doctor or a pharmacist. You can ask things like, given my personal risk factors, how much benefit is this medication actually expected to provide for me? Are there lower dose or alternative statin options if I'm experiencing muscle symptoms? Should we check my blood sugar periodically given the diabetes risk research? Is it worth reassessing whether I still need this medication if my cholesterol and other risk factors have changed since I started it? These are reasonable, informed questions, and any doctor who's paying attention will be glad you asked them rather than treating your prescription as something never to be revisited. It's also worth saying clearly that lifestyle factors matter alongside medication, not instead of it. Diet, physical activity, sleep, and stress management all genuinely influence cardiovascular risk, and organizations like the American Heart Association recommend them as part of a comprehensive approach, not as a replacement for medication when medication is indicated. Some people, working closely with their doctor, are able to improve their numbers enough through lifestyle changes that a lower dose or a different approach becomes appropriate. Others, due to genetics, family history, or the degree of existing arterial disease, will still need medication, regardless of how well they eat or how often they exercise. That's not a moral failing or a sign that lifestyle doesn't matter. It's simply how cardiovascular risk works for different individuals, and it's one more reason a real conversation with your own doctor, who knows your labs, your history, and your specific risk factors, will always give you a more useful answer than a general video, including this one. There's one more thing worth mentioning, because it comes up constantly in this conversation. Cholesterol itself is not inherently evil. Your body needs cholesterol. It's a building block for cell membranes, hormones, and vitamin D production. The issue that statins are designed to address isn't cholesterol existing in your body. It's excess LDL cholesterol contributing to plaque buildup in your arteries over time. Content that frames cholesterol as some kind of dangerous foreign substance your body accidentally makes too much of is oversimplifying basic physiology to make a point. The nuanced reality is that for people with elevated LDL and other risk factors like high blood pressure, smoking history, diabetes, or family history of early heart disease, lowering LDL has a well-established connection to reduced cardiovascular events. For people without those risk factors, the calculation looks different, which again comes back to why this is a personalized medical decision, rather than a universal rule in either direction. If you take away one thing from all of this, let it be this. Questioning your medications is a healthy instinct, not a dangerous one, as long as that questioning leads you toward a real conversation with a qualified professional rather than toward quietly stopping something on your own or accepting a dramatic claim at face value just because it was delivered with confidence and a compelling story. Good medicine, the kind that actually helps people live longer, healthier lives, involves exactly the kind of back and forth we've been describing here. a doctor who explains their reasoning, a patient who asks thoughtful questions, and a shared decision that gets revisited over time as your health, your labs, and the research itself continue to evolve. Statins aren't a magic bullet, and they aren't a secret poison either. They're a well-studied medical tool with real benefits and real documented trade-offs, and the responsible way to think about them is with that same balance. If you found this helpful, the most useful next step isn't necessarily anything drastic. It's making a list of the medications you currently take, sitting down with your doctor or pharmacist, and simply asking them to walk through the reasoning behind each one with you. That single conversation, repeated periodically as your health changes, does more for your long-term well-being than any video, including this one, ever could on its own.